Hi there. My name is Dr. Naveen, and I'm a child and adolescent psychiatrist at Atrium Health's Behavioral Health Charlotte, a facility of Carolina's Medical Center. Just as it is for adults, mental health is an important part of the overall health for children and adolescents. In fact, many adults suffering from mental health difficulties had their symptoms first present in childhood. Unfortunately, these childhood symptoms are often poorly recognized or inadequately addressed. For a young person starting to show or demonstrating ongoing signs of a mental disorder, what is most important for a caregiver to do is to have his or her child evaluated by a trained psychiatric professional. Early intervention and treatment is vital to recovery and long-term success. Now, it can certainly be tough to determine if a child's troubling behavior is truly a problem or just a normal part of growing up. For this, caregivers can look for two specific hallmarks that would suggest that their child may benefit from seeing a mental health professional. Number one is time course. If a child's mood or behavior changes persist for longer than a few weeks, and certainly if they're going on for over a month, then a consultation would be warranted. Number two is interference in functioning. A consultation should also be sought out if a child's symptoms are interfering with his or her daily life or impairing his or her relationships with friends and family. Children and adolescents can suffer from the same mental health conditions as adults. However, their symptoms may appear a bit different. So what are some signs that caregivers can look out for? Younger children may benefit from an evaluation if they talk often about fears or worries, if they struggle to be apart from their parents or siblings, if they repeat actions or check things out of fear that something bad may happen, if they complain of recurrent or medically unexplained headaches or stomach aches, if they have frequent tantrums or demonstrate persistent irritability, if they are unable to sit still, if they experience nightmares with recurrent themes, if they seem uninterested in playing with other children or have difficulty making friends, or if they struggle academically or experience an unexpected decline in their grades. Older children and adolescents may benefit from an evaluation if they sleep too little or too much, if they have low energy or seem tired throughout the day, if they seem to lose interest in activities they previously used to enjoy, if they spend more time alone and avoid social activities with friends or family, if they fear gaining weight or diet or exercise excessively, if they smoke, drink, use recreational drugs, or misuse prescription medications, they have thoughts of suicide, they engage in self-harm behaviors such as intentionally cutting or burning themselves, if they experience periods of uncharacteristically elevated mood or energy, or seem to need much less sleep than usual or none at all, or if they appear paranoid and report hearing or seeing things that others cannot. If caregivers are concerned about their child's mental health, they can reach out to their child's school or pediatrician's office for guidance, support, and referral information. Here at Atrium Health, Behavioral Health Charlotte, we have a variety of ways that we can evaluate and treat your child. Our child and adolescent outpatient medication clinic allows for children to be evaluated and seen on a regular and ongoing basis by a licensed and board-certified child and adolescent psychiatrist. Our child and adolescent outpatient therapy clinic allows for weekly or less frequent individual therapy sessions with therapists trained in a variety of different styles. We even have psychologists on staff who are able to complete psychological evaluations and accept insurance. Atrium Health has licensed therapists working at a number of schools throughout Mecklenburg County. Our school-based therapy program is in various elementary schools, middle schools, and high schools, and the program can be very useful for families with transportation challenges or time constraints and minimizes the time from school a child may have to miss to attend appointments. We also have a 22-bed inpatient child and adolescent psychiatry unit that serves children ages 17 and younger, with a focus on acute safety and crisis stabilization. Each child is evaluated daily by a psychiatrist and has frequent individual and group therapy sessions facilitated by a nurse, social worker, or trained mental health technician. Child and adolescent partial hospitalization is often used as a step down from inpatient, but children may also be referred from an outpatient setting. Treatment is roughly from 8 a.m. to 3 p.m. Monday through Friday, with children returning home each evening and spending their weekends at home with their family. A consultation service, including psychiatrists and advanced practice providers, serves Levine's Children's Hospital. Children and adolescents admitted with a primary mental health issue or hospitalized medically but with certain mental health needs can be seen and followed weekly. The consult team facilitates in making outpatient referrals or having a child transferred for inpatient hospitalization if it is thought to be needed. Behavioral Health Charlotte also has its own psychiatric emergency department, just for children and adolescents. For kids requiring a little bit more time for evaluation, the emergency department has an attached observation unit where children are seen daily by psychiatrists and advanced practice providers on an ongoing basis. Lastly, please remember to never hesitate in calling 911 or taking your child to the nearest hospital in any emergency situation. If you think your child may need help but are unsure and need some guidance, you may call our 24/7 Behavioral Health Helpline at 704-444-2400 and speak to a licensed professional. Thank you, and be safe.